Are you about to give birth and you have a huge fear of needles? Well, don't worry, you are not alone. This happens very, very often. My name's Sydney. I'm a labor and delivery nurse. Follow along for more tips and tricks. If you have a fear of needles, tell your healthcare providers at the time of delivery. So if you're going in for a scheduled C-section or you think you're in labor, just tell them, be like, hey, I hate needles. So if we can avoid needles at all costs, I would really appreciate it. I am a strong advocate for all of my patients having what's called a saline lock. So that is an IV that stays in your hand. That way you have access if you need it for any emergency situation. And I just want to say this IV saline lock, you do need a needle to insert it, but once it is in, it isn't actually a needle that stays in there. It's a little thin plastic tubing. So a lot of people think that the needle is still in their arm. It's actually not. It's just a little piece of thin tubing. I've actually been in situations where my patients have fainted because they've had an IV inserted and they absolutely hate needles. I've been in situations where a patient needs what's called laughing gas or nitrous oxide in order to get an IV inserted. So you are not alone. There are a lot of people who are afraid of needles. I would just say try to stay calm, breathe, distract yourself. So watch something, listen to music, anything that you find helps you when you are feeling stressed. And just know that it'll be over before you know it, and try to get your healthcare providers to distract you as best they can. The only situations where you are going to need a needle in labor is for that saline lock to be inserted. And if you are having an epidural, the needle will go in the back. So that is another thing, which is actually nice because you can't actually see it. So that might help you. Another time you might need a needle is if they're giving you emergency medication for like a hemorrhage, and that usually goes into your thigh, or if they're giving you a steroid shot, if you are in preterm labor, again, that goes in your thigh. So there's not a whole lot of needles involved, but sometimes we do need to take blood work as well. So you are probably going to be poked at least once. So hopefully you can mentally prepare yourself before you go in to have your baby. And again, just be super transparent with your healthcare team and tell them, I have a huge fear of needles. Like, if we can do this as painless and as easy, fast as possible, then I would really like that. And usually we have some tips up our sleeves and ways to distract you throughout this process.